Grabbing her first meal after crossing the Polish-Ukrainian border, Katerina Herikova looks almost relieved.
I took money and my documents, and that's all. Maybe one T-shirt.
The 25-year-old is safe and has plans to go to a small city outside of Warsaw. But for thousands of others who don't have set plans, there are hurdles they will face.
If you have a large number of people migrating in a short period of time, they're at risk of infectious disease. Right now, COVID is a big one.
As the war began, COVID cases in Ukraine were up 555%, according to a UN report. Vaccination rates are fairly low at just 36%.
COVID is not their main priority right now, obviously. They're a lot survival and taking care of their kids and making sure they get a next meal as they flee is going to be their main priority.
Paul Spiegel is the director of the Center for Humanitarian Health at Johns Hopkins. On Wednesday, the Canadian will be flying to Poland to support the World Health Organization's refugee emergency response.
You do everything from tracking the actual outbreak, surveillance, to then treatment, and it's labor intensive, and that will be much more challenging in Ukraine proper than outside.
Forced into tight quarters, basements and bomb shelters, COVID, tuberculosis, measles, chickenpox, and even polio could threaten lives, experts say. Shelling has damaged water systems, and communicable diseases are now also becoming a concern. For those who do get sick, hospitals are already overwhelmed with traumas, and access to essential medicine has dwindled. Although a humanitarian corridor has opened, the need is outpacing supply. For this 19-year-old who escaped, the shock of leaving home is setting in.
Nothing can be important than my family.
The responsibilities host countries now have is keeping them healthy and safe. Mauracher, Global News, Toronto.